the negative side of suggestibility. In the spring of 1938, Dr. Drayton admitted a 60-year-old African-American man to the hospital. The small hospital was located at the edge of the town in the old house that had been converted into a 15-bed hospital. 6 of the beds were located upstairs at the rear end of the house in what previously served as a sleeping porch. The patient was admitted to that porch. Vance Vanders. He had been ill for many weeks and had lost over 15 pounds in weight. He looked extremely wasted and near death. His eyes were sunken and resigned to death. Repeated tests and chest x-rays for both tuberculosis and cancer were negative. Coming in and out of consciousness, he said repeatedly he was going to die. Only then did his wife, who had stayed by his bedside, ask to speak to Dr. Drayton privately. The sick man's wife appeared extremely nervous and anxious. She made Dr. Drayton take a vow of complete secrecy and made him swear never to tell anyone the story she was about to tell. About 4 months after Vanders was admitted to the hospital, he had had a run-in with the local witch doctor, or voodoo priest as he was called. It was well known that many people practiced voodoo and that there were several priests in the area. Late one night, the priest had summoned Vanders to the cemetery. The wife had not been able to uncover why Vanders was called, but only that an argument occurred. While they were arguing, the priest held a bottle of some foul-smelling liquid and waved it in Vanders' face. The priest told Vanders that he had voodooed him, saying that Vanders would die in the very near future, and that even medical doctors could not save him. Vanders was doomed to die. He staggered home that evening and did not eat again. Several weeks later, he was admitted to the small hospital in a morbid state. Terrified, especially since they had seen Vanders' illness unfold as predicted, they kept the story to themselves. Seeing that Vanders was near death, the wife came forward to tell Dr. Drayton in hopes that he could somehow miraculously save her husband. Dr. Drayton spent a long time that night thinking what approach he should take. Whatever he did, he knew it had to be done right away or else Vanders would certainly die. The next morning, with his plan in mind, Dr. Drayton came to Vanders' bedside. He had asked for all of his kin to be present. 10 or more of them gathered in the 6-bed ward. They were trembling and frightened to be associated with this doomed man. They pulled away from the bedside as Dr. Drayton approached. He had announced that he knew exactly what was wrong with Vanders. He had told them of the frightening encounter at midnight the night before in the local cemetery, where he had lured the voodoo priest on some false pretense. Dr. Drayton said that he had told the priest that he had uncovered his secret voodoo and found out precisely how he had voodooed Vanders. At first he said the priest had laughed at him. Dr. Drayton said that he had used force and choked the priest to near death against a tree until the priest described exactly what he had done to Vanders. The story is, the voodoo priest had rubbed some lizard eggs into your skin, and they had climbed into your stomach and hatched out small lizards. All but one of them had died, leaving a large one that is eating up all your food and the lining inside of your stomach. I will now get that lizard out of your system and cure you of this horrible curse. With that, he had summoned a nurse. She had on pre-arrangement filled a large syringe with apomorphine, a powerful liquid to induce vomiting. With great ceremony, Dr. Drayton pointed the syringe at the ceiling and inspected it most carefully for several moments. He had squirted the smallest amount of clear liquid in the air and lunged forward towards Vanders. The patient had by now gathered enough strength to be sitting up wide-eyed in the bed. He pressed himself against the headboard, trying to withdraw from the injection. With dramatic motions, Dr. Drayton pushed the needle into the arm of Vanders and injected the full dose of the apomorphine. With that, Dr. Drayton said nothing and dramatically left the ward. In a few minutes, the nurse reported that Vanders had begun vomiting. When Dr. Drayton arrived at the bedside, Vanders was wrenching. One wave of spasms after another. His head was buried in the metal basin that sat on the bed. After several minutes of continued vomiting, and at the point judged to be near its end, Dr. Drayton pulled from his black bag, artfully and secretly, a green lizard. At the height of the next wave of wrenching, he slid the lizard into the basin. He called out in a loud voice, "Look, Vance, look what's come out of you. You are now cured. The voodoo curse is lifted." Several relatives fell to the floor and began to moan. Vanders saw the lizard through his squinted eyes, did a double take and then jumped back to the head of the bed with eyes wide open in shock. He did not vomit again but drifted into a deep sleep within a minute or two. His pulse rate was extremely slow and his breathing became extremely deep. The sleep lasted well over 12 hours into the next morning. Within a week, Vanders was discharged from the hospital. Within a few weeks, he had regained his weight and his strength.